Hello, folks. I'm here with Sam Beckett, who is a psychologist and also the counselling team leader for Stepping Stones. Hello, Sam.
Hello.
Sam, can you tell us, firstly, who Stepping Stones are and also what measures you're taking during this crisis to help those that maybe suffer a wee bit more due to isolation?
Yeah, absolutely. So Stepping Stones, we're a mental health organisation. We're a third sector, which means we're a charity organisation. We work across Western Bartonshire, but we work very closely with our NHS peers in the mental health teams, community mental health and primary care mental health. And obviously, like a lot of places, it's been a huge impact on our work with this coronavirus situation, sort of immediately having to suspend all of our group programmes and our appointments. What we've done to combat that is we've tried to continue working as normally as possible within these new confinements. We're offering all of our usual support services via telephone or video messaging, and we're also working on getting our groups reconnected using social media and video conferencing and these types of things. So we're really trying to maintain all of the different types of support that we offer people in Western Bartonshire as much as possible in this time, as much as people are happy to connect with us using technological mediums.
Could you give us, Sam, as your role as psychologist, what people should look out for, both personally and maybe family members, people that may have been suffering from mental health issues previous or developed them during, obviously during the isolation? What signs to look out for, and what advice would you give for that?
Absolutely. I think it's really important to remember that it is okay to feel worried and anxious and down at the moment. There's been huge changes to everyone's lives and to the world around us. And we're kind of constantly bombarded with these messages about danger and safety and all of these things going on. And we're very susceptible to messages like that as human beings, particularly when they're related to our safety. So if you are struggling at the moment with mental health, then that's absolutely fine. And at the moment, if you're also feeling great and things are going well for you, then that's fine as well. So that's really important to remember, to just kind of honour what you're feeling and where you're at the moment. I think in terms of signs of struggling, definitely one of the sort of main things that you'll notice when someone's struggling with their mental health is that their behaviour and possibly the way that they're speaking and interacting will change. So change is probably a big thing to look out for. If somebody's becoming very isolated, not answering phone calls, if somebody's verbalising to you that they're really struggling with the changes, sort of using words that they're struggling or feeling low or anxious, then that's what to listen for. If you're concerned about friends and family, or in yourself, if you're noticing kind of changes to the way you're feeling or reacting, behavioural changes, these kind of things. So things have changed. We've been forced to change, but if you're noticing that you're struggling repeatedly to cope with the situation at the moment, then that's something to look out for.
Okay, thank you very much, Sam. Great advice. Can I ask you, Sam, if people are needing additional support in that, do you have contact numbers of that for them to call, maybe Stepping Stones and maybe any other organisation, you know?
So at the moment, the best way to access mental health support is to go to your GP initially. GPs are still open for normal practice, even though that might not be face-to-face at the moment. So do seek support from your GP initially at the moment, and they can make referrals to either ourselves or other relevant mental health teams. There's a couple of helplines specifically for mental health, so a lot of people will probably have heard of them, Breathing Space and Samaritans. So Breathing Space is usually open evenings and over the weekends, and I know that they're increasing their capacity at the moment to cope with the demand. So you can get in touch with Breathing Space on 0800 838587, and you can get in touch with Samaritans 116 123, and Samaritans are 24 hours 7 days a week. A couple of other helplines that are worth keeping in mind as well. Parent Line Scotland is a really good helpline for parents that, you know, obviously are struggling maybe with kids being at home all the time, or maybe kids not coping with the current situation. So you can contact Parent Line on 0800 028 2233. And there's also a general coronavirus helpline set up by the Scottish Government for advice and information. And you can contact them on 0800 028 2816. And don't forget NHS 24 as well. That's a number to get in touch if you're struggling with your physical health or coronavirus symptoms or concerns.
Thanks very much, Sam. It's spot on information. Is there anything else, any message that you have for anybody that maybe suffering, any additional message or advice?
I think just remembering that there is still support out there. We're all having to do it in slightly different ways now, but we are supporting people with their mental health. I think that what we've experienced is a lot of people coming together, communities coming together, friends and family contacting each other more often. So just don't feel isolated. Contact people around you, stay in touch using social media, telephone, all of these types of things. It's really important at the moment when you maybe can't see people face to face or go out and spend time with people, is find other ways to stay connected and to stay supported within your community and your friends and family and your social circles.
Brilliant advice, Sam. Thank you very much. Thanks very much for giving us some of your precious time, because I understand
No
we're all
problem
running
at all.
off the beat at the moment. And from everyone at Clydesider, all our readers, thank you very much, and stay safe and well. Okay.
No problem. You too.
Okay.
Thank you very much.
Bye now, Sam.